I know a lot of us are trying to do more with less. If you know anything about my background, I'm a physical therapist, private practice owner. I own and operate two clinic locations. They used to be two full-time clinic locations. Now one of them is down to about 2 mornings a week. The other one still is full-time. But what's happening is we are struggling to find and hire staff. We're not actually even looking to find and hire staff anymore. But my main administrative staff is dwindling down. They're getting busy with other things, family commitments. And so I'm trying to find ways to automate tasks that maybe don't need an actual human. And I want to run an idea by you. So I know YouTube isn't usually back and forth, but I want this to be a little bit interactive. So be prepared to give me your response in the YouTube comments. I am looking at all of the updates and changes that are going on with AI. You guys know that I'm advisor to HippoScribe, which is an AI scribe specifically for physical therapy. I love the product. I love the developer. I love the founder. Everything is just awesome. But one of the things that I was thinking about was, is there a way for HippoScribe to introduce an AI voice assistant so that when a new patient calls my clinic phone number and they want to schedule an evaluation, is it possible that we could get the evaluation scheduled? They can do that through online scheduling or other means. But then I could have an AI voice assistant that starts to ask that individual questions that will auto-generate into a clinical documentation. Now, it could go straight into the EMR based on integrations. It could go into the HIPAA-compliant HippoScribe platform, and then the therapist who's going to do the evaluation face-to-face would be able to review that information and make sure that it's giving us all the information we need, and then, of course, support that information with questions that are asked face-to-face. I'm thinking kind of real general. It's like, could I get a voice AI to get information like, tell us about the condition will be treating. When did it start? What makes it better? What makes it worse? All the normal past medical history. We can maybe ask questions about medications. We can ask questions about surgical history. We could even ask questions about functional outcome measures. So I like to use the upper extremity or the lower extremity functional scale. What if we had an AI voice that could ask questions related to that functional outcome measure so that all of that information would automatically be available for the therapist to review? Now, if you go back a decade and a half, I used to have a human that would do that. Our patient representative would call new patients that are scheduled for an evaluation and go through all of the same questions. But if I'm trying to move away from dependence on other individuals in the organization and outsource to a HIPAA-compliant AI platform, this to me seems like the ideal situation. So my question to you is, do you think this is something that you would use? It doesn't exist on the market right now that I'm aware of. It's a voice AI assistant that would ask prospective patients all of their past medical history information and then turn that audio recording into a transcription, turn that transcription into clinical documentation. Would you use it? Would it be helpful? Let me know in the comments and I'll let you know what I decide, because I'm going to try and test this idea out a little bit over the next month.